Welcome back to our cranial cruciate ligament series. Again, this is part 2 of what are the warning signs, and then giving you ideas on how to find them and then fix them before they can become a CCL tear. What we're going to look at today is our postural changes, our weight bearing, our patella position, and probably the most important for you, patella motion, and finding when there's a problem to help prevent that cruciate from being injured. The first thing we want to look at is angulation. We know that in most cases, dogs that are straight-legged in the rear are more likely to tear a cruciate. It just is, right? Lots of research. So how do I know if my dog's straight-legged? Well, we look at the angulation. How do I know what the angulation is? I'm going to show you. In this Akita, he's pretty straight-legged. If we have him in a stacked position, meaning his metatarsals are straight up and down, and I measure the distance from the line of his metatarsals up to his greater trochanter, the top of his hip, tiny little distance. He's pretty straight. In comparison, if we look at this lab who's angulated beautifully, if we take the line of his metatarsals and go straight up, it's a long distance to his metatarsal, or to his greater trochanter, or the top of his hip. He has beautiful angulation. He's much less likely to tear his cruciate. Another thing with posture is the dog telling us, hello, my knees hurt. I don't want to stand right. I'm going to stand in a different way so that it doesn't hurt, right? So look at this corgi. He has beautiful posture. We look at his withers, we look at his pelvis. He has a nice straight top line. A dog whose back end hurts, now I'm not telling you it's always his knee. Sometimes it's the hip, could be the hock. A lot of times it's the knee. He's going to straighten up his back end, and his pelvis is going to be higher than his withers. Can you see that? It's coming down. Now, occasionally you'll have like Shih Tzus who are down on the carpus, and that can cause that too. But either way, we see the pelvis higher than the withers. It tells us most of the time, if they're not down in the front, that there's something going on in the back. And if we leave it alone and don't fix it, we're going to cause lordosis, sway back, and back pain. How do we know when it's fixed? Because there's more angulation to the leg, and the dog's going to have a flat top line again. It's a beautiful thing when that happens, and we can do it. Let's talk about the sit. All right, this is super, super common. Now, this guy actually has a luxating patella, but that can lead to, we'll talk about that in a second, a cruciate injury. I saw for years dogs that would puppy sit beyond 6 months of age. The side that would sit out is the side that would tear, right? So if you have a dog who's sitting like this with their back on their butt, one, they're going to have back pain because they're putting it into flexion, but also they're going to have to pull with their front end, have a lot of issues, and they're more likely to tear a cruciate. Look at this guy sitting way on his butt, right? Not a good thing. How do we fix it? If you have a dog that's doing this, they're going to do sit to stands. They are going to be asked to sit a lot. And they're going to be praised when they do it appropriately and corrected with a get up, try it again, and guide them into the right sit. So that becomes their new normal. This is a bad habit. A straight sit is a good habit. So we like good habits. Let's look at what happens when the dogs say, oh, my back end hurts so much, I'm going to pull my weight forward. Look at these front legs. They're actually underneath him, right? They're actually under him instead of being straight down. He's saying, my back end hurts. Something's going on. Again, I can't tell you hip, knee, hock. It's in there somewhere. You want to find it and fix it. And again, then he won't pull his weight forward. Or you have to change the habit, because he may be in a habit of doing that now. Great test, weight bearing. Use one hand. I don't care if it's left hand or right hand, but you're going to use one hand because your hands give your brain different information. And you're going to pick up each leg. I do all 4. You pick up one leg, hold it for 10 seconds, gently put it down. Pick up the next leg, hold it for 10 seconds, gently put it down. You can do the front legs too, only one hand. And what that's going to tell you is how much weight bearing the dog wants to put. Now, they have to stand square first so that they're stable. But if you pick up a leg and it's bothering them, they're going to be going, woohoo, you can have this leg. You can do whatever you want with it. I'm not really putting a lot of pressure on it. It hurts to put pressure on it. So we're just going to let you do whatever you want. If you try to pick up the other leg, so if this is the left side and you pick up the right side, they're going to be like, no, 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 no. You can't have that leg. That leg is the one I'm putting all my weight on. I need to have all my weight on that. You can't pick it up. And it gives you an idea if one of their legs is bothering them. Again, find the problems early so we can fix them so that they don't tear their cruciate. Let's talk about patellas. Right? Now, these are human pictures, but it's a great way to explain something to you. This is our normal. So this is the femur. This is the tibia. We have our little fibula back here. And the patella is sitting where he's supposed to when the leg is in extension, just above the groove. You can also have what we call patella alta, which means it's high. This is the one that you grab the patella in extension and you're going to be like, oh, look how much it moves. Oh my gosh, is it going to luxate? No, it's not. Okay, good. Whew. Now, they may be more likely to luxate. We're not going to go there, especially traumatically, but you also have patella baja, which means it's lower. Now, the ones that I have felt, I would put them up maybe a little bit higher, but what I want you to know here is that you have that leg in extension, you're not moving it. You have the groove, and the patella sits right here, and it is in the groove, so you can't move it side to side. Whereas in normal and in alta, it's up high and you can move it side to side. Why do you need to know that? Because we're going to be motioning the patella. So we have it in extension. One of the things we're going to say is, can we luxate that patella? Right? Here's our little guy that has the luxating patella. We are going to have it in extension and say, grab that little patella. Can we push it medial? Can we push it lateral? If it pops out of the groove, we have a luxating patella. Why is that important? That patella tendon is super important because it's a major structure to prevent that tibia from coming forward, which is what our cruciate is doing. So he's helping the cruciate. So when he's out of the way, we're more likely to have a cruciate injury. The other thing I want to check is I want to ask these guys to stand up. I wrap my hands around their knees and ask them to sit. Sometimes that patella will pop out when they go from standing to sitting and putting that leg in flexion. So we check it that way too. Then we have the important one, patella motion. You can check this on your own patella. Extend your leg, grab your patella, make sure your quads are relaxed, and then move it left to right, left to right, and in both diagonals. It should move evenly and freely and have lots of motion. If it moves in one direction and not in the other, that might be a problem, right? What could have happened? Well, what could have happened is there was some kind of injury, and then the body puts scar tissue down, and what does scar tissue do? It contracts, right? It's going to fix everything. Except now that it's contracted, if we don't fix it, every time that patella goes through that groove, it is grinding on that one side in the groove. It's going to wear the cartilage away off the patella and off the femur in the trochlear groove and create inflammation. And inflammation is what is our predetermining factor for a cruciate injury. So we want to find it, and if there's a restriction, fix it. And I have lots of my clients that I teach to find that patella and move it so that we don't have the secondary inflammation that can lead us down the road to potential cruciate injury. The last thing we're going to talk about is pain, right? Because we can assess if some of those fibers torn. If I'm looking for drawer, I'm going to have one hand on the kneecap and behind the femur and one on the tibial crest and behind the tibia. And I'm going to try to push that patella, or I'm going to try to push that tibia forward. If I don't have any motion, my cruciate should be intact. But what happens if I have discomfort? It may still have most of the fibers intact, but if it's uncomfortable, you may be bing, bing, binging those little fibers, right? Let's find it, fix it, so that we don't have a problem. The other thing is if I do a thrust test, right? Now I have my fingers behind the femur, and this is just a hair's breadth off of the tibial crest. And then I flex the tarsus, or the hock. And when I do that, if I have a full tear, that tibia is going to come forward and smack my finger. But if I don't have that, but I have discomfort, again, that tells me that there can be significant bing, bing, bing of the fibers, and it's leading up to a partial tear. It's probably a partial tear, but we can call it that because there's not enough of the fibers to be torn because it's still mostly stable. So, a lot of information to think about. And there's lots of ways that we can help these dogs so that they don't lead to a cranial cruciate injury. All right. In the next video, we're going to go through what we can do in all of these things. So, I'm Dr. Laurie McCauley with Optimum Pet Vitality. I hope you had fun. I hope you learned something, and I'll see you in the next video.